to this now. Many South Africans are still concerned about the pros and cons of the COVID-19 vaccines. The country received its first doses of the COVID-19 vaccines yesterday, with more expected later this month. Now, vaccine take-up will be voluntary, but the hope is that most people will be vaccinated. Joining us now is Professor Jeffrey Mphahlele, a member of the Ministerial Advisory Committee on Vaccines. Prof, thank you very much for your time. I want to start on a controversial issue. At least I think it's controversial. You'll tell me if I'm wrong about it. The president last night saying that the vaccine is not compulsory for people to take. No one will be forced to vaccinate. Does that statement help in the fight against COVID-19? Or, I'm unsure how to phrase this question to you, but does that statement help in this fight against COVID-19, that you are going to have a choice not to take this vaccine if you so wish? But then what hope is there that people will build immunity against this vaccine?
Yeah, thank you very much for having me, Tolly. So it is an interesting thought, because I think the issue here is that the president was traversing an area that he knows, people do have constitutional rights not to partake in certain activities, and he did not want, to force anyone to take the vaccine.
Yeah.
However, as you rightly say, what does it mean if you don't take the vaccine? Obviously, you may choose not to take the vaccine, but you should know that you are putting the lives of other people at risk, including your own life.
And Prof, while you are on that very point of putting other people at risk, for whatever reason that you do not take this vaccine, what happens in a place, for example, where I am? I'm in a working environment. There are those who are going to say, I'm taking the vaccine in order to protect myself. There are those who are going to say, no, for religious or other reasons, I can't take this thing. And then they get infected. What then?
Yeah, so because you have opted not to take the vaccine, if you get infected at the workplace, you should not really blame, the workplace as unsafe, as a place that exposed you to COVID-19, because you were given an option to get the vaccine and you opted not to get the vaccine. So I think that one is very clear. It becomes a little bit muddy if then you are infecting, your colleagues at work, because what happens then? Because if you do that, and maybe your colleagues get infected and they fall ill because they were still waiting for vaccination. I'm just using this scenario to avoid the fact that your colleagues wouldn't be vaccinated or wouldn't be willing to get the vaccine. They are still waiting to get vaccinated. Then that is actually an important question that we need to entertain. Because even if you do have the rights not to do certain things, but you should also take accountability and responsibility on certain issues, especially on part of what you do as an individual.
Prof, before the technology lets us down, as it doesn't announce, quickly let me put this question to you. There's news just in, and you are someone that I think is also a clinician, so you should be able to answer this one. News just coming in is that AfriForum has won a court case where doctors do not necessarily have to ask for authorization before they can prescribe ivermectin for patients suffering with COVID-19. Your thoughts on that?
You will be pleased to know that I'm not a clinician. I'm a medical scientist. Not necessarily running away from your question, because it is an important question. I think the court issues related to ivermectin are things that, given the nature of the pandemic and the magnitude of the pandemic, obviously people would like to use every opportunity to make a difference in the management of COVID patients. So if the court has given the go-ahead, there's not much people can do. The doctors will prescribe, and until maybe an organization like SAPRA, maybe they decide to challenge the court case, nothing will happen really, because the court has given the doctors go ahead to do the treatment.
Spell it out for us, the concerns around ivermectin. The conversation thus far has been around there are tests that are being run to make sure that it is safe for use on human beings. You tell us, as a scientist in this field, what the concerns have been around the use of ivermectin.
So the concerns are mainly on its efficacy as a treatment for COVID-19, because there is anecdotal evidence from the doctors and from other people who have been using it as a treatment. In fact, there are also clinical trials going on to look at whether ivermectin has got efficacy against the treatment of COVID-19. Unfortunately, we are not at a stage where we can say that there is sufficient evidence to prove that ivermectin can actually be used, or maybe those who are using ivermectin for treatment, there is a real benefit to the patients compared to those who are not using it. So that has been really the key issue. In terms of the safety, I don't think that is a big issue, because it's a drug that has been with us for many, many years.
Sure.
But the issue was just the efficacy.
Final question, Prof. The vaccines that are in the country, we are told they are 70% efficacious. That's the wording around this. They're 70% effective. Should we trust them? And I think that's the question.
So there are a number of ways to interpret the data. So the easy way is that we can rely on the efficacy. The efficacy tells us that the vaccine is 70% and maybe another vaccine is 95%. So if you ask a question, what is actually a measure of efficacy? You will realize that most vaccines, the measure is actually laboratory confirmed symptomatic COVID infections. So that's what is the vaccine is efficacious against. Then if you say, if you are vaccinated and then you get infection, what happens? What is the outcome of this infection in somebody who is infected? Then you see the real benefit of getting vaccinated, because if you get infected after vaccination, ideally, you should not have severe disease. You should not end up in the hospital, and you should not end up in ICU. So for me, those are the real issues that we need to concern ourselves with.
All right, Prof, I must thank you for your time. I'm completely out, and yes, I am going to be strangled now, but I need to squeeze this one in. I've just spoken to a medical student, a research student, who says the cases of reinfection are almost next to none. Is that true? Based on his research. Based on his research, I have to add.
Yeah. Okay. So it depends on reinfection in what. So if you're talking about somebody who previously recovered from infection,
yeah,
and is reinfected,
yes,
we can't say is near to none, because we do have cases that have been confirmed globally. So there are cases of reinfections from people who recovered from symptomatic COVID-19.
All right.
So we do know that it is happening. It doesn't seem to be happening at a large scale, and it doesn't seem to be something that should really, be on the way of rolling out vaccines. But it is taking place.
Prof, we thank you very much for clearing that up for us, and we hope to talk to you again. This is an ongoing story. It's an ongoing issue in the country, this pandemic, and there are new discoveries every day.